Now, I think previously we spoke about contamination of patient samples and all of that within the radiology laboratory. You know, how patients can actually get to those hospital-acquired infections, a lot of things around it. But also, there could be contamination outside the radiology department. And what are the ways that we work towards trying to, stop these contaminations? So for contamination outside the radiology department, that's outside the radiology department, is very important because patient staffs and equipment, they move through multiple hospital areas. So here we're actually talking about the equipment used in the radiology department. So as those equipment, they move them within the hospital. So you don't want those equipment to pick up infections. You bring it back to the radiology department. Then later on, a patient is brought there to be worked upon, and the patient picks up a disease as a result of your, mistakes. Okay. So you want to prevent the spread of pathogens. So how are they actually being able to control those infections that could come from outside? So patient transport, moving patients from different wards to another before they come to the radiology department, it can spread pathogens. Do you understand? So you have to be careful about that. Portable imaging equipment. So all those mobile X-rays that they can even pick it from the radiology department, take it to the X-ray department just to take imagings, and the rest of it. They can pick up contaminations from 1 or 2 units. So you have to be careful about that. Also staff movement, of course. If somebody's working in the radiology department, you don't expect the person to be there throughout the day. So they move around the hospital, they go to see their colleagues and all of that, and handshakes, the rest of it, touching people are all sources for contamination. They also shared surfaces. Okay. So infection control include hand hygiene. So you have to wash your hand before you touch a patient. You have to wash your hand after you touch a patient. The personal protective equipment, you have to wear all those gloves, all those gowns, all those masks. Then proper disposal of the PPE before leaving the contaminated area. Then equipment cleaning. That's all those portable X-rays, ultrasound machines, and disinfections. Okay. Every time you use them, you have to disinfect. Of course, before you use it on the patient too, you disinfect. So patient transport protocols is infected patients are usually transported with a mask or covered stretchers. Then there should be routes that maybe a hospital will make, to minimize the infection spread. The environmental hygiene is a regular cleaning of all those corridors, the lifts, the waiting areas, immediate disinfection of surfaces after transport. Then you always train your staff so that they are fully aware that such a thing actually exists, and they should always be cautious of it.